Many of you may ask why or how we came out with the SafeCut protocol. And it's a long story, and it's an emotional story. In 2011, I was delivering a course with live surgery, and I was talking about the way we are doing bone harvesting with the Khoury's protocol. And I think I did hundreds of cases with the Khoury's protocol. What happened? What happened? Something that was not possible to predict. It was concrete during the surgery. You know that with a freehand approach, we have to generate the fracture after performing osteotomy on the surface. And this fracture line involved the alveolar canal. So the alveolar canal and the nerve was inside the block I was trying to harvest. And that was for me a shocking moment. 10 minutes really of something that as a surgeon you would not like to leave. But from that point, I really realized that step in the Khoury technique was the weak link of the chain and was the chance to me to share an idea and to develop with Andrea Fincato the protocol of the SafeCut. SafeCut is, first of all, a high controllable technique and predictable technique that allowed us to harvest the bone needed to perform a bone augmentation procedure. So the idea was to change the way of working in the surgical field. You know that when we are looking on the CBCT in the diagnosis phase and then we are looking on the surgical scenario, we as a surgeon, our brain is the connecting point between the diagnosis and the surgical performance. But this is under stress or is a weak point because we are not every time at 100%. So if we have stress, if we are not 100% in the surgical field, we may end up with something that is unexpected, something that is a complication from a surgical perspective. So we wanted at that time to take out this, to make the harvesting as smooth as possible, as safe as possible, as predictable as possible. That was SafeCut. And now in the last 12 years, we worked developing not just the harvesting, but also the guided block management and the guided block fixation. Meaning that we are reducing the stress during the surgery, we are reducing the unpredictability during the surgery by improving the predictability, the reproducibility of the process, because everything is decided in advance. And then, like in a Lego box, we have just to follow step by step what has been decided during the planning. So if I'm thinking the way we were working 10 years ago and the way we are working now we are really 100% predictable in what we are doing. We are reducing the surgical time, we are reducing the stress, we are reducing the skill required to perform the surgery. And this is really a great development. Every time there is a simplification and a reduction of the skill, it means that the technique developed on a step forward compared to the past. So this is SafeCut. It's not just a guide. It's a complete different way of approaching the surgery, increasing the control, increasing the performance, and make the surgeon life easier. I'm not talking about patient safeness because that is obvious, but the surgeon life is completely different compared 10 years ago. So this is SafeCut. It's a new word, it's a digital word, and nowadays digital is everywhere. So why wait to introduce digital in your bone augmentation procedure? Come to us and learn about the computer-guided bone harvesting, block management, and guided block fixation. Ciao.